Okay, so everybody, this is Nicole Snyder. Nicole, could you tell us a little bit about yourself?
Sorry, Nick. It froze. I didn't hear what you said. Oh, it froze again. Now it's back. Sorry.
That's okay. I just introduced you, and could you say a little bit about what you do, who you are?
Yes. Okay. And just so my name is Nicole Snyder. I am a nurse practitioner and mother of four. So that's great and awesome. I used to be an NFP instructor, but my first two jobs got to be too much, so I stopped teaching NFP. But I still love it and use it and am all for it. So I'd love to share a little bit about it today. Nick, do you want me to just kind of give a little spiel before we get into the questions?
Well, sure. Well, do want to start with just like a
Great,
basic definition.
great,
So I'm going to say something, and then you can critique it however you feel necessary.
great.
All right. So by NFP, we have
Mm-hmm.
in mind an umbrella term denoting different methods of monitoring a woman's naturally occurring biological markers of fertility in
Mm-hmm.
order to determine the infertile and fertile times of her menstrual cycles, and allowing the awareness the couple gains through that monitoring to aid them in either avoiding pregnancy or conceiving a child.
Yeah, that's great. And I think that somebody asked a question. So I was receiving some email questions from your class, and one of the questions was, what's the difference between NFP and contraception? And I think just to sum up what you just said, Nick, I think of NFP as a way to gain knowledge about what's going on. And then the couple can use that knowledge to make decisions about what they want for their family. So, which is different than contraception, which is always a method of avoiding contraception, so, with the caveat that somebody asked me some questions about medical stuff, and we'll talk about that in a minute. But using contraception as contraception against conceiving. There's no decision making. It's like, this is what this thing is for. And natural family planning is a way to gain knowledge and to understand what's going on in the woman's fertility. And then they can use that knowledge to make decisions.
Right.
Does that make sense? Okay, great.
Yeah. I mean, if uh, if conception is not desired, then you're not uh, actively doing something to go against the possibility of conception, like you're abstaining, like that's
Yep,
it. So
yep,
it would be called contraception.
yep. Right. So if it's the I think of it, once you're married, it's no longer like the man's fertility and the woman's fertility, it's the couple's fertility, because it's true, physiologically men are always fertile, but you're not fertile unless there's also a woman that you're engaging in intercourse with. So it's a couple fertility. So thinking about the fertility of that couple, that only happens for so many days a month. And so when you know when those days are, then you can choose what to do with those days. If you're going to engage in achieving pregnancy behavior, or you're going to engage in abstaining behavior.
Mm-hmm. Yeah. Now, I actually got one question that was thrown my way
Great,
by somebody. Well, it doesn't matter who, but
great.
it was actually about the history of NFP. Now,
Oh, good.
it kind
I
of
don't know too much about that. Um, so I can give you a little bit of what I know, but I am not super prepared for this question. So feel free to look online for more info. But do you know, Nick? Do you
well,
know the history?
my response was just like or my initial response was just, it's as old as time. Like I can't
Well,
imagine. I mean,
yeah.
some
So
aspects of NFP would be.
yeah. So using well, I guess I should say it's really cool because when God created us as in women, he gave us clues to know what's going on, right? And that's just for anything. Like if I've got like I was just outside and I've got a little like scratchy throat, itchy eyes, like my body is telling me springtime allergies. Okay, that's like a signal my body is giving me. Women have always had the signals that tell them when fertility is happening, but knowing how to interpret those signals and coming up with a formalized plan to use that knowledge, I don't believe happened until the 1920s, I think. Um, that was also the time when the first hormonal contraception was starting in England. So I might be getting my dates wrong, but it wasn't like a very long time before that. So it was can't remember the method was called, but it was some kind of calendar method where you would take you would chart how long it took for your menstrual cycles, and you would count so many days before it started, of course, between those times. So it was not a very accurate method of avoid because limited than that. So as time progressed, more advanced and really cool, and we've got scientific studies to prove how accurate different methods are. And what's we like to show you some cool scientific studies on the accuracy.
Nicole, you're freezing up
But
a bit
okay,
on the side. Is that?
it could be me. Fine. I didn't freeze up, but other times I have.
Okay. Well, let's just, we'll continue on
So
as, and then we'll just see. Um,
okay.
yeah, I mean, I've heard of other cultures. Like Wendell Berry brought up this in his book, The Unsettling of America, that um, it was about this tribe in, I think, Afghanistan, where they kind of took pretty radical means of spacing births because of they were living in the mountains, so they couldn't really provide for a lot of offspring, and so like the woman would actually leave the husband's bed until the child was weaned.
Yeah.
So I mean, I know that I'm guessing that different cultures had different methods of handling it. Yeah, that's a good question.
Yeah. And this is really cool because thinking about other cultures, a lot of third world countries are in a really tough spot with financial resources and education resources. And so teaching women NFP in the third world is a really cool mission field right now. Mother Teresa and her sisters actually taught a simplified version of the method that I used to teach, and literally all you need is toilet paper. That's all you need to learn this, and it's really awesome. So yeah, and the for those who were trying to avoid pregnancy, the pregnancy rate when the sisters were teaching them was like 0.003% or something super, super low. So it was really, they were able to learn it and they were able to use it, and it worked great.
That's awesome.
Yeah.
So yeah, you want to start with your presentation now?
Sure. So let me share the screen. Okay, so the first thing I want to do is just super quick talk about female reproductive anatomy because, yep, you can. Because a lot of people don't know this, and it's crazy. I cannot tell you how many patients I have that I have to draw them pictures to explain what's going on. So here you see the ovaries, fallopian tubes, this is the uterus, and this is the cervix. If anybody has gotten a pap smear, this is where the pap smear is taken, and this is the opening of the vagina here. So a couple of things I want you to just note. Almost nobody knows about this. This is called the cervical crypts. This is where mucus is produced. So if anybody has noticed different times of the month when you wipe with toilet paper, it might feel kind of slimy. It's this. This is what's happening right here. These cervical crypts are creating mucus, and it's awesome, and it's not abnormal. It's not a sign of illness. So it's cool. So the other, this slide just kind of talks about the phases of the menstrual cycle. And what's interesting is you girls probably have recognized that your menstrual cycle might not be regular. That's also really normal. And you can see here's a short cycle, a regular cycle, and a long cycle. What's interesting over here is the post-ovulatory phase. Here's ovulation. Here's the post-ovulatory phase. After ovulation until the start of the next menses is almost always stable if everything's working correctly, okay? So the pre-ovulatory phase is what is very irregular. And so you start playing soccer, or it's summer break and you're not doing anything, or you've got a really hard test that you're studying for, or a pandemic happens and your whole life changes, who knows what. Stress or any significant lifestyle change can change this pre-ovulatory phase, okay? But once ovulation happens, the post-ovulatory phase stays the same. And without teaching you exactly like how to do NFP, because we don't have enough time to do that here, but the fact that this stays the same is why NFP works. Because if we can figure this out, everything else is able to be figured out, even if irregular cycles are happening. Okay, so here is a picture of the ovary. Inside every woman's ovaries, even from when she was a tiny baby inside her mom's tummy, as soon as the ovaries are formed, even before the baby is born, this girl baby has millions and like a huge number of eggs, okay? Once menstruation starts, a few eggs every month are chosen to start developing into follicles, okay? So these are the follicles. One follicle is chosen every month to become the most mature follicle, the granddaddy follicle, and get the most nutrients. And then ovulation happens. You see the egg is being released out of the ovary. What's left over of the follicle then is called the corpus luteum, okay? So why is this important? So the two main hormones that dominate the menstrual cycle, called estrogen and progesterone. Beginning of the cycle, estrogen's in charge, and that's what's happening over here. Estrogen is making the follicles, is in charge over here, okay? So what is estrogen and progesterone? You can think of it as saying, hey, follicles, start getting these eggs ready in case they're needed to keep this corpus luteum going because we might need it. Yeah.
Thanks.
Yeah, but
What's that?
Nick? Oh, should I redo it, Nick?
Yeah, sure.
Yeah, okay.
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 Essentially, once you started talking about um, progesterone and estrogen, that's when you froze up.
Okay. I'll just do it quicker. Okay. So the two main hormones that dominate the menstrual cycle are estrogen and progesterone. You can think of any hormone as a message. So the message is being sent to do different things. And the estrogen is sending messages in the ovaries to say, hey, ovaries, get these eggs ready to ovulate. The progesterone message is saying, hey, get this corpus luteum ready and nice and fat and thick and healthy because we're going to need it potentially later on. Okay. These same messages, the estrogen and progesterone, are also giving a signal other places in the body. So this you can pretend is the lining of the uterine wall. Okay, so here's estrogen's in charge over here. See the eggs getting ready to ovulate, and here's the corpus luteum, the progesterone's going over here. In the lining of the uterus, you've got the estrogen is in charge. See, all these cells are getting more numerous, more cells lining the uterus, okay? And now over here, the progesterone, it's not necessarily getting any more, it's kind of plateauing, but it's getting really thick and nutritious and lots of blood flow in here. So again, the same signal, the same message, estrogen and progesterone. They're sending the same signal, but the message is different in different parts of the body. Okay, ovulation only occurs once in each cycle. So even if there's twins or triplets, they might have more than one egg that's ovulated, but it only happens in one day, in a 24-hour period. So that's important too. And the egg only lives for 24 to 48 hours. Okay, so let me get to one more slide that I want to show you about. 1 second here. There's the message is happening in one more place that I wanted to get to.
Nicole, as you're looking for that, I was wondering if you know as to, well, it seems kind of amazing that if a woman is in a period of stress, that the menstrual cycle would change.
That's like, crazy.
Like protection.
Yes, let me tell you about that. Okay. There's been research done in war zones where there was a big bombing or there was some kind of mass exodus. Everyone had to leave the town. Something majorly stressful that was stressful for everyone. And they've done studies on babies born 9 months later, and there's not many. What's going on with that? It's that ovulation was suppressed for everyone at that time. It's kind of like your body's way of knowing that, hey, this is a really stressful time right now, and this is not a good time to get pregnant. So actually, I'm going to go back to that slide. 1 second. So back to the signals. Okay. So back to this ovary picture. So if the follicles were developing right here, and then a big stressful thing happened. Your grandma died, or your dad lost his job, or something big, okay? Your boyfriend broke up with you. Your body doesn't know, or you get the flu. It can be physical or emotional. It doesn't have to be one or the other. And different people will have different stress levels. So for somebody, the flu might be enough to suppress ovulation, and for somebody else, it wouldn't. But if something stressful happens here, your body will pause this, and the follicles will stop developing, and they'll just kind of pause. The stressful event will end, and then it'll pick up where it left off, and then you'll ovulate whenever, a few days later, or whenever your body notices that your stress level has decreased enough to carry on with ovulation. So it is really, really cool. And when you're charting, you can see these different things. They're called double peaks. So, yeah.
Can there be more than one double peak?
Yeah, I've had at least, I can remember having 3 peaks in a cycle at one point when I was under a lot of stress. There also can be just, instead of a double peak, a prolonged absence of peak. So like it'll seem like your cycle is taking 2 months, or you'll skip a cycle. That's potentially due to stress. Okay. Hey, so, and then get back to back to the messages, right? So the messages are telling your body different things. And it's happening in the ovaries, and it's happening in the walls of the uterus. And there's one more place that it's happening where your body is getting the message from estrogen and progesterone to do something. So here we go. Okay, so this is the cervix. Okay, so it's much smaller than this. This is blown up just to kind of see what's going on. But see, just to orient you, here's where a pap smear is taken, down here, and then up here you can imagine this connects to the uterus. Okay, so a developing baby would be like around here. Okay, in here, this is called the cervical crypts, and this is where the estrogen and progesterone are telling these crypts to make mucus on days where a woman is fertile and all the things are lining up. Estrogen is in charge. The cervical crypts are going to produce a type of mucus called estrogen type E mucus, and you can see the sperm are just swimming up this type of mucus just like channels. When progesterone is in charge, it creates a thick, sticky mucus called progesterone type G. The sperm can't penetrate it. It's like a brick wall. So that's really cool. And then let me show you, this is, I have a picture of this is actual cervical mucus on seen under a microscope. So here's the type E mucus, the estrogen mucus, and see these little channels? This is just like a highway straight for the sperm. And what is amazing, God is like so amazing. They've done studies measuring the width of these channels, and it matches exactly with the width of a sperm. It's like the same exact width. And this is cool because this is also a protection. There's a lot of sperm, and some of them are not healthy. These channels help only the healthy sperm get through, because if the sperm is too big or too small or like crooked in any way, it's not going to go up the channel correctly. So another way that God orchestrates everything to be just perfect and amazing. So here's the type G mucus. This is the progesterone mucus. And you see it's like a brick wall. No sperm is getting through there. And again, it's just really cool. So, and it protects the uterus from things getting in there when it's not supposed to get in there. And so it kind of acts like the door is closed when this G mucus is there. Okay. Nick, does that sound clear? Any questions there?
Yeah, I thought that was very clear.
Okay.
I'm definitely learning.
Great. Okay, so some more pictures here. Okay. Okay, so what happens if, getting on to NFP. So that was basically just some cool information about somebody's asked a question about mysterious. This is like mysterious And it is that, I think, because I think there's like a little bit of a stigma talking about these things because they're private, and it is private. And there's some kind of like, I guess classiness is the word that's coming to my head. Like, we're not going to talk about type E mucus in the hall. That's just like, that's not what we're going to do. But in a classroom setting, like in a doctor's office, between you and your mom, like we need to know about this stuff, because this stuff is really cool and your bodies are really, really cool. Like, are you serious? Your body makes this every month. I get really passionate. I get really excited. But like, this is amazing, and women should know about this. And I'll tell you, I mean, 10% maybe of my adult female patients know anything about this, and I have to chart and like draw things to tell them what's going on. So, okay, great. So here's just like an example of an NFP chart, like what it would look like. We don't have to go into the details, because if you want to learn how to actually chart, I can get Mr. Brem the information so he can pass it along. But for example, and also too, this is only one method of NFP. Different methods will have their own charting systems that might look a little different. But just in general, the red stamps, and there's apps and all this stuff. I use an app now, but but let me just say that too. If you use an app to track your cycle, I think that's a really good thing. Don't think that it's the same as learning NFP. You actually need to like learn it and have somebody teach you to know what's going on. So, okay, here's the menstrual cycle, and then a period of dryness. This is what's typical. And then these white baby stamps, this is when the cervical mucus is happening. So here's the estrogen is getting really really big, lots of estrogen, telling the ovaries to start developing that egg, telling the lining of the uterus to start preparing, and telling the cervical mucus to start producing that type E mucus, okay? Where it comes green here is when that type G mucus is in charge, because now progesterone is in charge of the cycle, okay? When progesterone is done being in charge, there's no more progesterone, the progesterone falls, and you start all over again with a new cycle. The rapid decline of progesterone is what signals the body to get another menstrual cycle going. Okay, and then the babies are to remind you that these are the days where a new baby might be welcomed into the world if you are going to use achieving behavior. Okay.
Now,
yes. Mm-hmm.
Some of the mucus, they helps keep sperm alive, right? So that way,
yes.
It's like,
yes.
wow, there's only like a 12 to 24 hour period where you can conceive.
Yes. Good job, Nick. So yeah, so the mucus, or excuse me, if we only were relying on the 12 to 24 hours that the egg was alive, almost nobody would get pregnant, because that's like a very specific window. But the mucus can keep the sperm alive for up to people had intercourse here. The woman didn't ovulate until here, okay? So 1, 2, 3, 4, 5, oh, the mucus was still alive, and they were able to achieve a pregnancy. But if they were to have intercourse here, this is a day of no cervical mucus, because there's no mucus to keep it healthy. Good question. Okay. So so this is just some cool things. They did some hormone studies where they were able to tell by laboratory tests when the woman ovulated, and it correlated with this whole peak thing that I was telling you about, the mucus cycles. Here, the woman ovulated here and had intercourse on this day, in intercourse on that day. That capital I is what that means, but they did not achieve a pregnancy. Why? Because there was no mucus. So this would be called an infertile cycle, even though she ovulated. So this is where health issues come into play, because if I was somebody's nurse practitioner and they were trying to achieve a pregnancy and their cycle looked like this, I would be like, well, now I know what your problem is. You're not going to achieve a pregnancy like that. So there's things to do. There's things to do for that. So trying to get these. Okay, here's some other health issues potential. So here, this would be another like concern for infertility. There's just one tiny mucus day here. That might not be enough. This chart makes me worried that somebody would be at high risk for a miscarriage, because look at how short this cycle is at the end. So ovulation happened around here, but then only a few days later, a new period started, okay? So there's not enough progesterone at the end. Progesterone's not doing its job. Progesterone's taking a vacation and not staying around long enough to support a baby. Here's another example of low progesterone. Low progesterone isn't taking a vacation, but it's being lazy on the job, and it's letting bleeding come in too early. And then this abnormal bleeding, this can mean a lot of things. And I would say if anybody's going to be nervous about abnormal bleeding, talk to your doctor about it. It's a good thing to just say, hey, I'm having some abnormal bleeding. It's something that should get checked out, but in the high school age group almost never means anything bad. But it's good to just mention it. For an older patient, this would be concerning for something even as serious as cancer. But for the under 20 crowd, it very likely does not mean that, but you should just mention it. Okay, so it's really cool, because if somebody wasn't tracking, this stuff could be going on and they don't know for years. They just think that that's normal, or they don't even pay attention, or this is happening, and they just go through their young adulthood not knowing that something might be wrong here, until now they're trying to have a baby and things aren't going well, and they keep having miscarriages and nobody figures it out. So charting actually is super, super helpful for the medical provider to be able to see, aha, I think I know what's going on here, and then they can help treat it. So, great, yeah, Nick, any questions on, one more thing I did want to say. Okay, so this was a relatively large study. This was the number of couples involved in this study, but this was the number of couple months. So they were using the method for this number of months, all the couples combined, okay, across all of these different cities. And to avoid pregnancy, the method effectiveness, I'm going to explain what this means. The method effectiveness means like they are doing things so well, it's like they're in the lab all the time, like they're dotting every single I, crossing every single T, no room for error. It was 99.5% effective. So that blows all artificial methods of contraception out of the water, that method effectiveness, except for surgical stuff. Use effectiveness, that's like real life. That's like, oh wait, what was that thing again? Nicole told me, but I can't remember what. And so in normal life, real people mess up, but still 96.8% effectiveness is hugely effective compared with the use effectiveness of hormonal methods of contraception, and way bigger than barrier methods of contraception. And then this is the studies about effectiveness to achieve a pregnancy. And this is amazing because infertility in couples is really, really devastating. And a lot of times, the couples that I have seen that have had trouble with fertility, a lot of times they don't even know when to target fertile days. They don't know like what signs to look for. So, well, yeah, if you're picking the wrong days, then that's going to be a problem to achieve a pregnancy. So this was couples who already they were normal fertility couples. Okay, so they didn't have any health problems. Knowing which days to pick, 76% of the couples were able to achieve a pregnancy the very first month, and then 98% by the 6th month. People who don't chart, these numbers are a lot lower. People can go a whole year with trying to achieve a pregnancy and just kind of guessing before they say, oh, there might be something wrong here. But for NFP couples, it's well below the 6th month that they have success. And then this.
So Nicole,
Yeah, go ahead. Mm-hmm.
is the increase in percentages due to the gain in familiarity with the couples, or is it something?
No, that's a good question. Or just length of time. Maybe the first and third cycles, don't know. So something for the almost 30, maybe about 22% difference between the first cycle and the 6th cycle. Yeah, I don't know what the variable was there. Awesome. And then, okay, this one's my favorite. Did turn on the light. This is couples who have been told that they were infertile. Okay, so they were trying to conceive at least 12 months went by. That's a couple is having fertility issues when they've been trying for 12 months and nothing happens. So for those couples, just learning the system, between 20 and 40% of them were able to get pregnant with no medical help, which is awesome. But then up to 80% of those people were able to get pregnant with using this method of natural family planning specifically, but I would imagine it would be the same for all methods of natural family planning, using that knowledge plus medical treatment. And this doesn't mean artificial reproductive technologies that would be not consistent with bioethical stuff. This is like stuff that is ethical, ways to help somebody with their fertility stuff. So up to 80%, that blows artificial reproductive technologies way out of the water. The success rate for that, at the time that I was trained in this, which was a few years ago, but it was like 45%, not 80%. So that's pretty awesome. So great. So that was all I had about the slides. Nick, any questions on that before I go to the questions? Mm-hmm.
Just a comment about the artificial ways of production. I mean, isn't it true that they try to expose like a lot of eggs for to get fertilized, and so then that's one reason why you have like with among couples using IVF or in vitro fertilization, a lot of them end up having twins. Is that?
Yeah. So when I'm saying artificial reproductive technologies, IVF counts as those, but other things too, artificial insemination. There's other ones too. So, but with IVF, yeah. So what they would do is either the woman's eggs or somebody else's donated eggs. They'll fertilize many because a lot of them don't take, and it's really expensive to do IVF. So they, out of the doctor's compassion, they want things to work for this couple. So they insert many eggs at once, hoping that at least one or two of them will survive. If more than one or two of them survive, then they usually electively abort the other ones.
I was not aware of that part.
Yeah.
It's kind of messed up.
Yeah. But this is so cool. Like, there's a way cheaper way, a way that doesn't have yucky ethical quandaries to it, and a way that is so amazing. And like, it makes you feel really glad that God is so awesome and he knows what he's doing, and he made the cervical mucus have the exact right size channels. Like, what? It's so cool. Yeah. So great. Somebody asked what was my experience with couples learning NFP, and I would say a lot of them are a lot of the couples that I have taught, it was a requirement of them. They wanted to get married in the Catholic Church, and the church said, well, you know, you have to do all of these things before the wedding day. One of these things is learn NFP. And so it was kind of like, we have to do this because the priest told us to do this. And I would say, I can't think of one couple who didn't. All of them learning about this stuff, it really did increase their awe for God's creation and the respect of how important sex is. Like, this is like, yeah, thinking about all the planning that went into this, like when God created our bodies, like there was a lot of work that got put into that, and to make the channels exactly the right size, and to make the sperm the exact right size, and to make it so that we could have figure out how to do all this, and how to figure out what the cervical mucus was telling us. And I mean, there was a lot of work all of this. And so I think that's something that I've seen in couples, is that they have more respect for each other and the undertaking that they're going to do in getting married and starting to use the gift of their sexuality. It's kind of like, wow, this is actually like,
Could you repeat that last part, because you froze during that?
I froze, you said?
Mm-hmm.
Okay.
About yeah.
So yeah, I guess, so I'll say it again shorter. So I would say what I've seen from couples is that they come away after learning about NFP, they come away with a more sober and like awe-filled approach to kind of like the seriousness of sexual intercourse, and kind of like a respect for their sexuality, and like the huge gift that it is, and the gift that the other one is. So I would say that. And then communication is the other huge one. Communication is really, really hard. I've been married for 10 years, and that is still the thing that we're working on. Like, we've been married for 10 years, and I have an awesome husband. But communication's really hard. What'd you say, Nick?
Who's left-handed?
Who's left-handed? Yeah. Yeah, he's a wonderful, wonderful husband, and we miscommunicate every day. It's like very hard because he's a man and I'm a woman, and that doesn't go well all the time. But NFP, like, it puts into, it just like puts communication into, it like forces communication. Okay, so like every month, when my fertile days come around, we have to sit and have a serious conversation about what we think God wants for our family. So we have to do that every month. Contracepting couples, and I do see this with my patients very frequently, years will go by and they haven't had a conversation about it. And like, okay, well, I thought I was going to have a baby by age 25 or whatever. And oh, wow, you know what? We've we just kind of let life happen. We didn't even discuss it, because life is so busy and communication is so hard that is actually what happens. Unless you're forced to communicate about something, it is hard to get the serious stuff in the schedule, in my experience anyway. So that's another thing that I see, communication, about what God wants for their family for their fertility, but then also that spurs conversation about, well, what does God want for our family even outside of fertility? Is there, oh, we can't get pregnant right now? Is there a reason? Yeah, there's a reason. Have you helped me do the chores in the last 2 weeks? No, you haven't. Oh, well, now we have to talk about that. And yeah, so it really, it's really cool. It's really life-giving.
One question I have
Mm-hmm.
is, let's say a woman is on the pill or using some form of hormonal contraceptive. Um,
Mm-hmm.
how fast, if she stops using it, do the cycles, does her menstrual cycles just kind of go back to normal quickly, or does that take some time?
That's a good question. It can go back quickly, but I've seen it. I would say the typical we tell patients is to expect about a 6-month lag time. And then sometimes I have seen it even much longer than that, where somebody went off hormonal contraception and it's been a year or more and their cycles haven't returned to normal. So yeah, I have also seen it come back quickly, but I would say the average is around 6 months. Somebody asked a question about that too. Is there any form of unnatural contraception that doesn't affect fertility? So just to be completely 100% honest, I don't want to I don't want to leave. That's a really good question. So barrier methods of contraception would not affect the physical workings of the fertility cycle. So that's one.
IUDs?
IUDs. Okay. Okay, IUDs.
Barrier.
I say that only because I see so many problems with them. Copper's really bad for you. Now this is so I work in a kind of practice where I'm checking people's nutritional levels a lot, and checking their copper specifically. And women on hormonal contraception without copper, just like the pill or a shot or whatever, their copper levels are crazy. There's something hormonal, and postpartum mothers too, their copper is crazy. So there's an interplay with that I don't understand quite yet, but I see it happen a lot. But then inserting copper into your body, yeah, I would say that's not really the best idea. You're supposed to have some copper. Too low copper is good, or too low copper is not good either. But yeah, I see problems with that. The kind of IUDs that most IUDs now have hormones, and that's how they're working, because there's a lot of side effects of hormonal contraception. So the medical world would really like an option where they could have the most amount of benefit for the least amount of side effects. Like, that's what we want from any medication. So it's a smart idea to think about, how can we deliver the hormones just to the place where we need them to work, and so that they don't have to go everywhere. So the thought process is good, but the negatives are still there to different levels of degrees. Somebody asked a question about what those negatives were. Let me share my screen again. Let me get to some place real quick. There's so many different ones that it seems like I'm not going to be able to talk about all of them, but just getting to a website. So I recommend, if you guys want to look up medical information about any medication, Apocrates.com. Okay, so I'll share my screen so you can see it. This is better than WebMD or whatever. This is what most medical professionals that I know about drugs. So trying to share my screen. Yeah. Okay, and then you can pay a lot of money to get what doctors need, but you don't need to do that. You could just look up the stuff that's for free. So my internet's acting slow. So you can go here and you can look up any medication. Come on. Okay, while that's loading, okay, thinking about hormonal contraception, what is that doing? So why is it working? It works in several different ways. It, remember the signals, right? So increasing these hormones and not having them, one is in charge at one time and then another is in charge at another time. It's mimicking pregnancy. So your body is getting the signal like it was pregnant. Okay, so think about what are the oops, I'm trying to look up side effects. Whoops, adverse. Okay, so thinking about the common side effects for most of these hormonal contraceptions are going to be the same kind of side effects as the first trimester of pregnancy. So acne, depression, emotional lability means you're up and down, weight changes, abdominal bloating. Like this is the kind of breast tenderness, nausea. This is the kind of stuff that people generally experience first trimester of pregnancy because your hormones are crazy. Well, this is what's happening, and this is why the pills, when they're working, are working because it's mimicking a pseudo pregnancy in your body. Okay, so any of the hormonal contraceptions that you want to look up, you can just look them up, and then what you want to see, the bad side effects, are called adverse reactions. It always is going to list the serious reactions first and then the common reactions second. The serious ones, these are not common, but they're like life-threatening, like heart attack, stroke. That stuff's not good. And I've not seen any serious reactions to hormonal contraceptions except blood clots. I have seen that. What I do see though all the time is common reactions. So great, that was one question. Somebody asked, when would somebody use hormonal contraception for a medical reason? So not using, so like using a hormonal contraception pill for health benefits. So that's an interesting question. And that would be not outside the realm of ethical, because if we're using something for a medicine to fix something that's wrong, that's different than saying, I don't want the good things that come from intercourse. That's like a different, Nick, am I saying it right?
Intentionality. I mean,
yeah, intentionality. Okay, good. So when I'm thinking about a young girl who has serious cramps or like PMS that is just like off the hook, a lot of traditional medical doctors will put somebody on the pill to kind of like stop, like push the pause button on this whole body system. Like, she doesn't need it anyways, let's just push the pause button until she wants to use it. I have a hard time with that because I see that part of a woman's body not as just something to only pick up when you want to use it. Like it's part of you and it's good and it's really cool. Even if you're not going to use that to achieve a pregnancy, it's still like amazing. And just pushing pause on it without, if there's anything else to do. So I usually try to fix what's wrong without stopping the system. The other reason I do that is I tell people, usually what happens in my experience is once we go off the contraception, the problem is just there again. And we didn't fix anything. We just pushed the pause button. And when we unpaused it, we're back to the same exact situation we were in before with severe cramps or whatever. The one time that I have, and I would say it probably is a good idea just to push the pause button, is when bleeding is so severe that somebody's getting blood transfusions, they're passing out, we can't control their bleeding. Yeah, I mean, we can't have that. Like, you have to not faint. So we might need to push the pause button, but let's figure out what's going on while it's paused so that we can unpause it safely as quickly as possible. Yeah, hope that answered that question. Okay, Nick, I'm gonna look up my email and see if there was anything. I'm gonna unshare my screen. I think there might have been some more questions. Did you have more though, Nick?
I've got a couple, but I mean, I'd rather you answer their questions than mine.
Okay. Well, you go ahead while I get my computer to start working.
Yeah, I just have to remember it.
Okay.
What was that? I had one that I thought was good. Well, I feel like a lot of times you get people will react against, opposing contraception and supporting NFP by saying it's not practical. But I was wondering, what kind of insight you have into that. Like, yeah, it's not going to be as easy as just taking a pill or getting a shot once every 6 months or so.
Yeah.
But I think it seems very practical.
Yeah, I mean, I think back to the women in India that were taught by Mother Teresa and her sisters. If they can do it, I mean, we can do it. Now, here's where I would say it's a habit, and like any habit is really hard to get. And so that part, like the checking of the mucus and then figuring out what that mucus is and then charting it, writing it down so you don't forget. I mean, that's all it is. But actually doing that, when you unconsciously go to the bathroom and you just wipe and go wash your hands, oh, I forgot, I didn't do my, like, that's the kind of, it just takes work. So usually when people start when they're not sexually active, when they learn how to do charting when the stakes are low, so to speak, that works out better because they have time to get that habit before they're married. But yeah, so that's what I think is the biggest. The other thing is irregular cycles, breastfeeding, those things make it harder. What really makes it harder is constant mucus. Some women have mucus that looks like fertile mucus all the time, and that can be really frustrating if you're trying to avoid a pregnancy. But your natural family planning provider or teacher can help you. Every system has a game plan for that, a plan B for that, and so there's stuff to do for that. So if that's you and you think NFP can't work for you, that's not true. You just need to learn the rules for that situation for the system that you choose. Does that make sense?
Mm-hmm.
Okay, great. I figured out how to stop share. Okay. And getting to my email. So yeah, the other thing is now with apps and Zoom, and finding a teacher is a lot easier than it used to be too. So people don't have to learn in person anymore. So even if you are, I mean, we do have a lot of natural family planning teachers in Columbus, but say you were in a rural area and there wasn't a lot of support, well, praise God, we have the internet now. So that makes it a lot easier too and more practical. Okay, and then I'm just going through the questions that people sent me and making sure I answered all of them. Yeah, I think I answered all of them in a roundabout way. So if you asked me a question and you don't think I answered it enough, please email me and I'm happy to answer more.
Fantastic. I really appreciate you taking the time to do this. I know it would have been much better if this was in person, like you could actually get their feedback right away. But I mean, desperate times, desperate measures.
Yeah, right, right. Yeah.
I can't think of any other questions that I have. So, but yeah, thanks again.
Oh, you know, Nick, I did think of one more thing. Let me come to the website if you wanted to learn. If you wanted to learn about the type of natural family planning that I used to teach, it's called Creighton. So I'll share that screen here. So, okay, so this is called freedomfertilitycare.com. So you can get all kinds of information on this. There's other methods too. If you are wanting to learn this, I'm imagining it's because you have health issues and you want to learn about how to identify what those might be and try to get them fixed. So I do recommend this method if that's your situation, because there are medical doctors who are specifically trained in this, and nurse practitioners who then can read your charts and figure out what's going on. I can try to read other charts and I think it works out okay, but when somebody has this chart, it's easier to see the specific health issues. But if you're interested in other forms of natural family planning, these people can get you where you want to go to.
All right, great. Yeah, I mean, once again, thank you so much for taking the time to do this. I think it's awesome to learn about. And I mean, I just, from a guy's perspective, it just kind of blows me away how much detail is in everything regarding the female body, and especially like also once like the connection that the mother has with the newborn child too. Just I've got no words. It just blows me away.
Yeah.
I just don't. It's crazy.
It is crazy. Thank you, God.
Yeah. All right. So yeah, I hope you all enjoy this. And I know I found it very informative. So thank you once again.
Great. Okay. Bye.
Bye.